everybody. I would like to welcome Mr. Amit Sharma, who is the CIO and Head Partnerships for Cytecare Cancer Hospitals. A very welcome, very warm welcome in this fireside chat. So, Mr. Amit, I would like to start with your thought. You have an extensive experience if we talk about segments like life sciences and healthcare. So, what are the unique changes that we have seen in technology adoption across these sectors?
Hi, first of all, I would like to thank you and your team for inviting me for this discussion. So, as you mentioned, I have a privilege of working both in life sciences and healthcare. So, in my career span of around 2.5 decades, 25 odd years, both in life sciences and healthcare, one thing which I clearly recall is the increasing use of technology in almost all areas of work. Means I recollect my early days of the pharmaceutical clinical research, where the almost entire data generation was manual, basically on paper. And now we have a current scenario where we have most of data, in fact, even directly fed into the systems from a connected ecosystems like bedside monitors. So things have come really long way in the life sciences research space. And even in healthcare space, including the hospital, as we are talking. In fact, technology is changing the entire care landscape, where we talk of a smart use of technology, where the better insights are being available to clinicians to enable them to take best possible and data-driven decisions for the benefit of the patients. So concepts such as paperless hospitals, which was probably unthinkable about a decade ago, now it is a reality, again, thanks to technology. And it's not only enabling the function. I mean, technology is also resulting in newer form of treatment options for various diseases. Means use of robotics and lasers in the treatment is obviously very common nowadays. So if I have to summarize it, technology has resulted in a generational change that we can see both in healthcare and life sciences industry in last couple of years.
So I would also like to understand. I would also like to hear from you that what are the three things which excite you most about your role in your organization? Means you have spent an extensive career in the life sciences and healthcare sector. So what are the three things which excite you about your role across your career span?
So if I have to list three out of multiple things that excite me, and I'm extremely happy to state that it's really an exciting time to be in the Indian healthcare space. To list down, say, a couple of things. One strikingly thing that at least I would very proudly say about my current organization is the freedom for me to evaluate and execute any solution that has a potential to benefit the end user. And when we are talking of end user, it could be the patient, the doctor, or even the hospital user. Means our simple mantra is actually that we should be sure that ultimately it's benefiting the patient without unnecessarily increasing the complexity or the treatment cost for them. But we have exclusive freedom to evaluate those kind of solutions. The second thing which really excites me in my current role is the freedom the organization provides me to engage in cross-functional initiatives. And that is irrespective of technology interface. Even though I am a CIO of the organization, but I have complete freedom to kind of talk to any of the stakeholders in the healthcare ecosystem within hospital, outside hospital also. By this way, I get to engage and contribute and even learn a lot of more things which are very exciting things happening in the space of cancer care. Third thing which really excites me about my current role, which is more towards the head of partnership, is that I get to work with multiple different exciting initiatives. I get to engage with a lot of schools, colleges, a lot of new sort of a startup, especially when working with kids during this role. We try and come out with very kind of exciting solutions in terms of raising awareness about cancer and also supporting some of the cancer patients in whatever way we can. So I think these three things I can summarize.
So if we talk about the last 2 years, we have gone through a long period of pandemic. During this, particularly during the last 2 years of the duration, what are the changes that you are seeing in the healthcare models and healthcare practices which were not there earlier?
So I think, we all say in our day-to-day discussions also, and I think across healthcare industry, everybody feels there's these 2 years of pandemic have actually sort of resulted in a sort of a decade change in the healthcare industry. It means it was a tectonic shift. The entire mindset of the industry has changed. So one visible change that I see is very open mindset to collaborate with anyone and everyone in the healthcare industry, so that it is not relying only on in-house competencies. Because pandemic actually taught us the importance of collaboration. I mean, the COVID vaccine kind of a discovery is one such example of a collaborative approach where entire healthcare industry and life science industry came together to help in sort of getting the solution or getting the vaccine in almost a year time frame. So I would say use of technology, everybody acknowledged that it was a tectonic shift. Who could have thought of virtual consultations or video consultations or remote consultations even for super specialities like in cancer? I mean, this was kind of even unheard before pandemic. Then I think the healthcare industry, the hospital per se, they also understood the importance of being part of the research network and the advantages that it could result in finding the faster and the better solution for many of the healthcare problems. So I think these are the few things that I can summarize in terms of the changes that we see in last couple of years.
So, if you talk about India is still among the countries where with the lowest number of beds per 1,000 people, and in fact, the pandemic has only highlighted the gaps that we have in care delivery. So, how do you think hospitals are helping address these gaps with the help of technology? How they are leveraging technology to enable services to be delivered at the remotest of the person?
Yeah. So I think one important thing that pandemic kind of ensured or its aftermath has kind of cemented in the entire healthcare provider is that there are many things which can be managed remotely and even at home. And that is through use of technology. I mean, we all, I think in the healthcare industry are in agreement that technology should be leveraged in order to de-stress the entire healthcare system. That entire mindset of delivering the everything from the hospital premise, which was actually stressing, and then there was sort of a, as you mentioned, the bed to patient ratio. I think those entire myths have kind of been broken. I mean, many of the follow-up visits in many of these specialities, even in cancer, they can be easily managed by video consults. So they in turn causes less stress in OPDs. Home care, home collections, and even data collection using some of the connected devices help in this regard. So the other thing which I found is the collaborative approach, which I mentioned. So now using technology, many institutions can work and collaborate in providing better care to patients, which can even ensure that the patient need not travel to other cities or one city to one part of the city, and the hospitals can collaborate. So they can actually sort of manage the resources in a better way. Then smart use of technology, it can actually result in some of the reduction of the OPEX and the CAPEX for a hospital, which can actually be used for better usage of capacity expansion or creating some of the better service facilities outside.
So one more thing is that people are now talking about future-ready hospitals. So in fact, many of the healthcare groups are focused on building a resilient healthcare model and a future-ready hospital. So what according to you are the costs, what according to you are the risks and the rewards involved in building a future-ready hospitals, and how crucial is the role of technology to exactly make the hospitals future-ready?
Yeah, so when we talk of future ready, I mean, one thing immediately comes to everyone's mind is obviously technology. So no denying a fact, technology is the backbone of any of these future ready hospital that we are talking about. In fact, I see the hospitals as good as an IT organization in the years to come, because the more and more use of technology which is coming into the space, it's kind of turning the entire hospital, at least from an IT standpoint, into a sort of an IT organization. So obviously there is a huge cost. Now the double whammy for the hospitals is because they also are associated with a huge cost of the manpower cost, which is obviously the clinical and the nursing and the paramedical cost, which they can't compromise. I mean, and to top it up, then you have a sort of a technology cost which is coming in. So this is obviously a cost challenge. Now the hospital will have a challenge that how to bear this cost and how to kind of absorb it as well as pass it on to the end user, because ultimately the stress would also be to kind of contain the cost for the end user. I mean, this is not a kind of just a simple solution of investing and passing on. So that cost remains. And at the same time, when we talk of technology, there is a huge risk of, or rather a challenge of, the redundancy of the technology within the next few years, because we all understand technology is an ever-changing landscape. Within few years, the technology will change, and then this will bring the additional kind of a stress and challenge into the system of changing this. So this is a huge sort of a kind of a risk that I would see, or challenge I would see. Then sometimes the reliance of technology is also associated with some sort of a risk. I mean, too much of technology, as we have seen in the IT, banking, and some of the other sectors, like the cyber threats. Now, hospitals have traditionally been closed systems, so they have been saved from this. But when we open up to collaborate and use of technology, then these becomes a possibility, and you can't kind of just run away with it. You have to face them. So that again would come with its own associated risk, with including cost. But we have to live with it. Then there is a cost when we are talking of a future ready hospital. There have to be a change in which the way the hospitals have been designed, because patient now will expect a much different level of service standards as compared to a traditional hospitals which have been done. So this will be obviously a challenge for existing hospitals which are designed keeping in mind some of the traditional model. For a newer hospital, they can think of. Now, in terms of rewards, I would say one immediate advantage that you see is for this future ready hospital, actually they have a potential to reach out every nook and corner of the country. When we are talking of the hospital which have a potential to connect with everyone and even globe, I mean, you have a potential that you can provide some sort of a services, especially the expertise, to anybody outside the hospital net. You can have access to best of talents across country and even globe. I mean, the hospital, by using technology, they will have access to these specialists and super specialists. Now, again, at a industry level, the future ready hospital will have a potential to contribute to broader level in global clinical research industry, because the technology and the process improvement can help us in getting the better data, and the data can be provided to drug companies or the research companies, which would be ultimately benefited in their research area. So these are the few sort of rewards which I see in a future ready hospital.
Thanks a lot.
Thanks, Amit.
For more updates from CXO TV, please like and subscribe to our channel.